Hi, this is Stephen Osei. This is my final presentation for the class Healthcare Management Information System. Medicated errors have caused significant death in the United States. Healthcare advocates, both states and federal government, and other accreditation bodies look for ways to minimize this death on a daily basis. This paper will look into the benefit of implementing a computer provided order entry system CPOE into electronic healthcare records of the university healthcare system. According to Strohawk 2003, CPOE is an application that supports patient order for diagnostic and treatment services which facilitates safety, efficiency, and standardization. This paper will look into the best way that the university health system can implement this CPOE into all their chains providers within the university healthcare system. The objectives of the project is to elevate and optimize patient safety by improving quality of care and reducing variation in using evidence-based medicine. CPOE also will be tested if it can accommodate the regulatory standard expectation that enhance patient safety and standardization process to improve efficiency. Prior to the implementation of the CPOE, there will be an appointment of a compliance officer and a committee to safeguard the risk analysis strategy of the project. The committee will meet prior to the implementation and will meet periodically to find out if the CPOE can stand the test of time of providing the security and safety protocols that is already in place in the electronic health records of the university healthcare system. The University Health System CPOE implementation committee have visited various organizations that have already implemented CPOE in their electronic health records to ascertain for themselves the program capabilities, shortcomings, and potential downtime that can compromise the safety and efficacy of treatment option as prescribed by various providers within the healthcare system. The SDL process were also used to procure the best CPOE. This SDL process included the planning and selecting of best CPOE that will integrate well with the university healthcare EHR. The university health system have also procured many vendors to train its employees on how to effectively use the CPOE in making decisions that will enhance the safety and possible health outcomes for their patients. According to Garnet 2016, the traditional paper and telephone order pose severe risks to patient safety. The use of CPOE in the university health system will increase data documentation efficiency, will enhance communication between providers and across organization. It will also increase data accuracy because the system is have a built-in resources that will help physicians and clinicians to make decisions regarding patients' health within the system. The CPOE also have interoperability functionality, which will be able to communicate well with other applications that are already in existence in the university healthcare system. Federal and state government enact various laws to regulate and increase patient safety in the healthcare environment. Um, Laws such as HIPAA and HAT were enacted so that best patient possible outcomes will be achieved in this healthcare environment. Other stakeholders that focus on qualities are the Joint Commission, the National Committee for Quality Assurance, a Standard Development Organization, also looking to ways of improving the quality of healthcare through the accreditation process. And in this background, the university health system intend to engage physicians and clinicians and other care teams in training and visit to other facilities that have implemented CPOE in order to achieve possible outcomes through this new application into that have been integrated into our electronic health records. The number one challenge to healthcare systems are cyber attack. Analyzing and managing a big data also bring its limitations. The problem of IT downtime in healthcare are primarily due to cyber attacks. And this is the reason why the university health system will engage clinicians, IT specialists to come up with a realistic downtime guidelines to safeguard the CPOE in case there is a breach. Some of the benefits of CPOE will be it will foster smooth decision-making process, it will facilitate workflow operations, it will increase productivity of the employees, and it will improve data quality documentation. And some of its limitations will be it poses security and privacy threats, and it encourages cyber criminals from hacking into the system if there is not proper and efficient or robust security software installed into the system. Data governance outlines how healthcare organizations collect and manage data in accordance with relevant laws and regulations. In healthcare, HIPAA laws outline how EPHI must be handled and shared. Marvel 2017. The university health system strategy include creating the IT ramification of their healthcare policies to enhance services and streamline process and reduce operational costs. This will also satisfy the federal and state government incentive program initiated into meaningful use of healthcare data. The technical and structural interoperability building function of the CPU will not only resource the healthcare professionals, but it will also increase patient safety and better healthcare outcomes. As stated, the annual clinical death is about 29 billion, according to at WEDI 2011. However, the financial benefits of implementing this CPOE outweigh the risks involved, and therefore, perinatal pharmaceutical analysis and interventions or CPU forestall prescription errors. CPU can lower many clinical error deaths. It can minimize this annual 29 billion as being reported here. And then the economic impact is also seen on how effective and productivities of physicians in lowering the operational costs of the university health system. The CPU integration will also assist the university in cutting costs of operations. In concluding, while prescription documentation quality typically increase with implementation of CPU, system communication and patient quality of care will improve immensely once healthcare personnel fully grasp and navigate the CPU building features that minimize clinical errors. These questions have been answered throughout this presentation. What has been done to ensure CPU is easy and efficient to use? What programmatic protocols are in place during that time? And the CPU worth the investment? Below are my references for this presentation. Thanks for listening.